Let's start with this letter. You're a member of Chime. I'm a member of Chime. We've gotten this letter that was sent out not only on behalf of Chime. I mean, it was sent out on behalf of everybody. The American Association of Everything, the American Heart Association, Psychology Association, Nurse Association, a ton of hospitals, not all of them, but a ton of hospitals are on this. Johns Hopkins is there, BJC is there, UPMC, Northwell, Novant. You get the picture. I mean, this is actually the page of signatures is longer than the actual document by a long shot. It's almost 4 times bigger. So this letter went to the majority and minority leader in the House and the Senate. It's really on behalf of healthcare, and it's about establishing comprehensive telehealth reform. They applaud them. I mean, I'm not going to read the whole letter, but they essentially applaud them for the work that was done during the public health emergency. They say people have gravitated towards this. They like this. It has benefits to being a part of our tool bag for providers. And they make the case for this is likely to be something we want to be a part of healthcare moving forward. And then they ask for 3 things. They ask for the continuation of all telehealth waivers through December 31st, 2024. So they're asking for all the stuff that was put in place for the public health emergency to continue for 3 years, essentially. A little less than 3 years, but 3 years. Number 2, they require HHS to complete all feasibility, I assume, evaluations related to telehealth by fall of 2023 and combine findings into a single overarching dashboard with recommendations to inform permanent telehealth legislation. All right, so they're saying, hey, if you could, can you have HHS do all the data work before the end of next year? Seems kind of fair, 2 years to get all that done. And then the third thing they asked for is then to take up permanent evidence-based telehealth legislation for implementation in 2024. And they're asking for bipartisanship on this for a handful of reasons. And they close the letter with those reasons, which are essentially, this is a strong tool in our tool bag. It's also something that has high customer satisfaction scores. And they believe that it is also just important, especially coming through a pandemic, to recognize the value of something like telehealth to be available in the case of an emergency like we just went through. All right, so let's talk about this a little bit. Telehealth. I would assume so many health systems sign this and whatnot. There's nothing in this letter that I look at and I go, I have a problem with. I would assume you're pretty close to the same boat on this, right?
Right, totally agree, and was really happy to see this. I am looking at it. What about Hospital Association?
Hospital Association is not on there, and I do think that's an interesting one. I'm trying to think of why that would be. I'm sure they approached them.
Yeah.
Yeah, I don't know. Maybe when you talk to the providers, the actual people delivering care, they may still feel like there's work to do before they make this kind of recommendation. Although this recommendation doesn't indicate anything with regard to the actual telehealth technology or how it's integrated or the data flow or the usability. Yeah. So, I mean, these 3 requests are pretty sound.
They are. And one that strikes me is the idea that it needs to be renewed every 90 days. It's like have some certainty that they can count on, asking for what through 2024 and then making it permanent. Clearly care has shifted and telehealth and virtual care is here to stay. And how do we continue to make it work? The statement here, patient satisfaction surveys and claims data from CMS private health plans demonstrate many Americans, how many, have come to see telehealth as one of the most positive improvements to our nation's healthcare system in recent memory. A majority of US voters believe Congress should protect their ability and choice to see a provider via telehealth. It's being accepted. Our providers are making it work. Our providers are accepting it. So it's a no-brainer to me. But.